So most of the things that I've described in the previous videos, all the different forms or schools of thought in therapy, I've been mostly thinking about or referring to them in the context of individual therapy, which is probably the most common form of delivery of psychotherapy, where you have a client working one-on-one with a trained therapist, typically for 45 minutes to an hour, where they work on exploring feelings, work through life challenges, and make goals and make progress together. And so all those different schools of psychotherapy will use that hour in different ways to approach the problems that the person is experiencing. There's also group psychotherapy, where several clients meet with a trained therapist or multiple therapists to discuss a common issue that they have, such as grief or an eating disorder or anger management. And group therapy is useful because it helps expose these group members to not only corrective one-on-one emotional experiences, but also corrective group experiences in a society of people struggling with similar issues. And it helps decrease shame and isolation, and is useful most often when combined with a form of individual therapy. It does introduce some problems, though. Some clients in group therapies might have concerns about confidentiality or feel less comfortable sharing problems with strangers. And so, having, just like an individual therapy, having a good relationship with your therapist is important, as well as having a good relationship with the people in your group. The vibe of the group has to be supportive and focused and welcoming in order for change to occur. There's also family therapy and couples therapy. Family therapy often takes a systems approach, which is all about having the therapist trying to figure out and diagnose what is the system of this family. What are the power structures of this family? What are the dynamics of this family? For example, I was working with a family where it was two parents and three children, three daughters. There was a daughter who was about 25 and two teenage daughters who were about 17. And there was a dynamic. It wasn't two parents and then three children. It was kind of more like two parents with the middle child or the oldest child, I should say, and then the two younger sisters. The two younger sisters were twins. And so that created an interesting dynamic where the child, the oldest child kind of was an in-between parent and was kind of in the midst of that. And that is a very different dynamic than having three children of the same age. And so working through problems in a family and figuring out what are the dynamics of the family is common in family therapy. There's also couples therapy, which has many different ways and applications and ways in which it's applied. Primarily uses and borrows ideas from cognitive behavioral therapy to help two individuals express explicitly how they feel in certain moments and how they behave as a result of those feelings, and try to break any cycle of continuous arguments. A useful resource for those of you who are interested in further studies in psychology is the Division 12 website. So you've heard of the American Psychological Association. The APA has several divisions for specific areas of psychology. Division 12 is the Society for Clinical Psychology. And Division 12 has pushed this movement of empirically supported treatments for psychological disorders. What that means is they have researched what are the best, most evidence-based treatments or forms of therapy for specific psychological disorders. And so on this website that's also posted on our Canvas page, you can see a list of psychological diagnoses as well as the different treatments that are known in the research literature to be effective for those diagnoses. So for example, this page shows the psychological treatments for depression. And there are so many more than the ones that I mentioned, including behavioral activation for depression, acceptance and commitment therapy, interpersonal therapy for depression, which is becoming more and more popular, rational emotive behavioral therapy, which was also related to the work of Carl Rogers, and many others that take different forms of psychotherapy. Now, the question with all these different models and different ways of doing therapy is what works? You know, what what should I look for in a therapist? What should I do if I have a particular problem? If someone is struggling with depression, should they do interpersonal therapy? Should they do cognitive behavioral therapy? Should they do just cognitive therapy without the behavioral component? Should they only do the behavioral component? Should they do a mix? And it's an important question that is constantly being evaluated in clinical psychology. What makes psychotherapy work? What are the important factors for making certain therapies work better than others? In summary, to make it to perhaps make it a simplification and just give the final message that people have come up with, researchers have shown that you know what, the exact model or the exact theory that you use to approach psychotherapy doesn't matter as much as the underlying principles that make psychotherapy effective. So to say it another way, for psychological disorders in general, there's probably the most researched form of psychotherapy is cognitive behavioral therapy, and probably the most popular or most well applied, but it's not necessarily the best form of therapy. We don't have enough evidence to say that. In many situations, it's just as good as psychodynamic therapy or just as good as client-centered therapy. The exact model or theoretical underpinnings that someone uses to approach psychotherapy aren't as important as the essential features that should be that really underlie all of these different forms of psychotherapy. All of these different forms have some shared underlying mechanisms, and some researchers have shown that when it comes to predicting the outcomes in psychotherapy, a lot of it has to do with the therapy relationship, with the relationship between the client and the therapist. Having a good relationship with your therapist, a trusting relationship, is really good. Also, the contribution of the patient's own factors, their values, their culture, the own things that they bring to the table is often a big proportion of outcomes in psychotherapy. But there's a significant portion that is unexplained or can't be rooted to one specific form of treatment, not a treatment method or any aspect of the individual therapist, but probably has more to do with these underlying mechanisms that make psychotherapy effective. And some researchers have highlighted kind of three groups of underlying mechanisms that in order for psychotherapy to work, there needs to be a supportive relationship. It doesn't matter if you're doing CBT or just cognitive therapy or just or client-centered therapy, there needs to be a supportive relationship. The client needs to feel supported. Also, there needs to be some kind of learning experience that whether it's by insight or whether it's by corrective emotional experiences or learning more and thinking differently about your childhood experiences, the client has to be learning something. That's an important aspect. If you're going to therapy and you're not learning anything new, then psychotherapy is probably not going to work. And lastly, there has to be some kind of action. There has to be some kind of behavior. There has to be some kind of task, some kind of activation, some kind of modeling or practice or some problem that is attacked in a real way. So whether it's role playing in the therapy hour, role playing a difficult situation that might play out at work or at home, or if it's giving the client homework to say, hey, go confront this person at work, or tell this person that you're sorry, giving them some kind of behavioral action that they can do. There has to be some kind of behavior that is worked on in psychotherapy. And probably one of the most important things that makes psychotherapy work, as we alluded to earlier, is confidentiality. That psychotherapy is very different than talking to just an advisor or to a trusted family member because it's confidential. If you've ever had the experience of sharing a deep secret with someone and then finding out that they shared that with someone else, that kind of betrays your trust in that person. In the psychotherapy relationship, therapists are bound legally to not be able to share any information outside of the psychotherapy or the therapeutic relationship or outside of the therapy room. And also, more importantly, the therapist, ideally, if you're looking for a therapist, you want someone who is not a member of your family, not someone that you know, not the relative, not the friend of a friend, someone who is completely outside of your life, so that they can give you an objective perspective, so that they can talk to you in such a way that is unbiased or isn't leaning towards one way or another, or won't come back and have any repercussions on you because they know your uncle or they know your sister or they know a family member or know where you work, someone who's completely outside of your life and outside of your social network. And so this is important to know. That's really a big thing that makes psychotherapy effective, and a big reason why it's different than just talking to a family member or a friend.